Welcome back in. Today's Ask the Doctor segment is all about women's heart health. Dr. Anuradha Rao from Cardiovascular Associates is here to answer your questions. If you have a question, go ahead and give us a call, 741-9272. First of all, thank you so much for being here to help us answer these questions. We're talking about heart health, a big issue for women.
Absolutely.
Yeah, 1 in 3 women will have some kind of complication from a heart issue. Talk a little bit about what some of those could be.
Women are at risk for a variety of heart issues, but the 2 more common ones would be heart attack or stroke. And it's so crucial that women recognize symptoms, get checked out quickly, because the quicker they recognize and get themselves checked out, the better they're going to do if they do have a heart attack or stroke.
I think we have our first caller, Sylvia in Fairfield. Sylvia, are you there?
Yeah.
Okay, and what's your question for the doctor?
I have had heartburn in the past. I'm taking Prevacid for it, but even though I'm taking Prevacid, I have begun to have heartburn at night anyway, and I wanted to know if it was, how could I tell if it was my heart or something else?
So have you ever had your heart checked out?
Just the primary care doctor has checked it, in the office.
Okay, so if you're having continued symptoms despite taking Prevacid, it still could be heartburn, but it might be worthwhile seeing when you were last checked out and talking to your primary care physician about whether you need to escalate your care and see a cardiologist to make sure that it isn't a sign of heart disease. It's never unreasonable to come and get checked out by a cardiologist.
All right, thank you, Sylvia. I think our next caller is on the line, Joyce from Morris. Joyce, can you hear us?
Yes, I can.
Okay, and what's your question for Dr. Rao?
Well, I have, my heart gets out of rhythm, and I have mitral valve prolapse, and I have AFib. And I was wondering, how would you know if it's leaking around the valve, or without the doctor know it being
So,
leaking?
Joyce, that's actually a pretty straightforward question for us. You've probably had an echocardiogram, which is an ultrasound of the heart muscle, and the ultrasound of the heart can show us all the valves and if they are leaking or not. So I'm pretty sure if you have atrial fibrillation and you've seen a cardiologist, you've had that test done. So I think talking to your primary care doctor or to your cardiologist can answer that question.
I've lost you.
Oh, can you hear us, Joyce? Joyce? Okay. All right, we're going to move on. Thanks, Joyce. We're going to move to Linda in Tuscaloosa. Linda, can you hear us?
Yes.
Okay, and what's your question for Dr. Rao?
Well, I just wanted to know, I've just had 3 stents put in, and I never had any chest pains or anything, and I went to get a injection in my back for a nerve block, and they found out I had a heart problem. And I wanted to ask her some questions about these stents.
So what is your question?
Well, like I said, I had 3 stents, and there's one artery she couldn't get a balloon in to open it up.
Okay.
But now she's treating me with Plavix, and I was just wondering if that really works or if it's dangerous to try to have that other artery opened up.
So you brought up 2 issues in this question. So one was a great one that you brought up, and one is that sometimes people have heart disease and they have no chest discomfort or any symptoms. And so it's quite fortunate they found your heart disease even though you didn't have the classic symptoms of a heart attack. So it's really important for women to take note of shortness of breath, profound fatigue. If they have discomfort in another area of their body, not just their chest, perhaps their shoulders, their neck, or their jaw. They found your heart disease and they fortunately opened up 3 of the blood vessels, and it sounds like there was a small one they couldn't open up. And sometimes we can cause more harm than good, so your physician has been very prudent in not going after that one other blood vessel. It's sometimes better to leave well alone. And Plavix is a great medication. When you have stents, especially new stents, it's very important to take it to keep the stents open that you just had put in.
All right, thank you for your question. I think we're going to move on to Pat and Jasper. Pat, can you hear us?
Yes.
Okay, and what's your question for Dr. Rao?
Fatigue with increased heart rate. Blood pressure is fine, 130/80 or 74, but I just have wonder why I get up and in the morning I'm working and doing things, but I feel weak and So I just need to, see if this increased heart rate, is that from heart condition since the blood pressure is fine?
Yeah, so the heart rate responds to anything going on in your body. So say you're scared or you're anxious about something, your heart rate can go up. Fatigue also can be due to many different things. It can be related to the heart. It doesn't have to be related to the heart. It can be something as simple as not drinking enough water in the summertime. But it's definitely a reason, if you're having these symptoms, to go to your primary care physician, get checked out, and they can decide if you need to see a cardiologist at that point.
All right, Pat, thank you so much for your call, and thank you for being here. I think that's all the time we have today. We'll be right back. Stick with us.